Okay, title of this lecture is Coronary Circulation. And cardiac disease. All right. Not that they're all 100% related one to another. It can be not every condition of the heart is related to the coronary vessels, but a fair number of important ones are. So let's start with this. Coronary circuit is, anybody know? Or do you not want to answer because I'm recording? Okay. Coronary circulation is blood going to and from the heart muscle, otherwise known as the myocardium. Going to and from the heart muscle, otherwise known as the myocardium. Remember, myo and my both mean muscle. Okay. I'm going to jump in with a little box here so that we know we're not talking about, we're taking kind of a little bit of a side note from what we were just talking about with coronary circuit to say there's two other types of circuits. And let me explain circuit. You think, circuit, isn't that electricity? Circuit just means that it makes a circle, that it goes and then comes back. Electricity does the same thing. That's why all of your plugs have two prongs on them. Electricity is coming from the wall into your appliance, and then a current is going back out into the wall, into the panel. That's what a circuit is. Your heart, same thing. Blood is going from the heart all the way to its destination and then back to the heart again. That's why these are called circuits. So there's the coronary circuit. What's another one? Give you a hint. It starts with a P.
Pulmonary.
Yes, the pulmonary circuit. He's back. And pulmonary circuit is blood going to and from what? Yep. To and from what?
The lungs, the heart.
What does pulmonary mean? That's coronary's heart. Lungs, yes. As blood going to and from the lungs. Oh, that was tilted, sorry. And the goal of this circuit is not to supply blood to the lungs. What's the goal of this circuit? Yes, to put oxygen into the bloodstream. So we're sending it to the lungs. The pulmonary circuit's very simple. It starts with the pulmonary trunk and ends with the pulmonary veins. It's that short trip to and from the lungs to pick up oxygen. This next circuit here is very important. This is pretty much everything. That's called the systemic circuit. This is blood going to and from the body blood going to and from the body except the heart. Okay? It's everything but the heart. So it's like going to the body's systems. That's why it's called the systemic circuit. Going to and from the body. except the heart. So, so this would be like blood going to your brain, to the masseter muscle in your face, to your teeth, to your big toe, to your liver, to your kidneys. Everywhere else that's being supplied blood, with the exception of the heart, is a systemic circuit. Now, I'm jumping back into my coronary deal. So, without coronary circulation, the heart muscle will not get the oxygen and nutrients necessary for contraction, and it would die, and so would we, and that's not great. You're like, wow, this is the worst Friday ever. All right. My speaker was on. It was picking up somebody's cell phone signal, and it was going. Did you hear it? It's like. Okay. Watch the video later. You'll hear it. All right. So let's talk about this. There are 4 major arteries. And the coronary circuit. I thought there'd be some kind of correlation between coronary and coroner. You know, I was like, oh, that makes sense. You know, coroner is person. There's really not. Except that the corona means crown. Like the coronal sutures at the crown of your head. The coroner was somebody who was hired by the crown or the king to basically, from what I read, take the property from like executed prisoners and return it to the state. It's weird. The history's weird. So they were like basically someone who was an official from the crown or from the king. Therefore, they were a coroner. This coronary circulation, the best I can understand is that it's called that because it crowns the heart. It surrounds the outside of the heart. 4 major vessels. First 2 are really, really easy. The first one is called the right coronary artery. I bet you can probably guess the next one now. Yeah, it's the left coronary artery. Now these next 2, not as easy to guess. The next one is called the circumflux artery. Sounds like they're playing hide and seek. And finally, the last one is called the left anterior descending. It's kind of weird. They're like simple, 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 and then really detailed, complicated. Left anterior descending artery. This one's gets an initial, the LAD. And this lad is super important because this is the one that if it has a proximal obstruction is deadly. Not that heart attacks in general aren't bad, they are, but this one in particular is bad. Let's write that down and then I'll show you where these are located. So heart attack, anybody know the real name for a heart attack?
Cardiac arrest?
What?
Is it cardiac arrest?
That's just when the heart stops. It's weird sounding. Here's what it is. Ready? Myocardial infarction. I don't know why that reminds me of the word fart. I'm not exactly sure why. Maybe because it's in there. Like, take the C out, because that's what I needed on this recording. All right. Myocardial infarction is a heart attack. It's an ischemic event. Basically, it means that the blood flow to this tissue has stopped or been halted in some way. Myocardium is just heart muscle. The infarction means a stop of blood flow or tissues that are starved of oxygen. Heart attack, and it's caused by an obstruction of blood to the heart muscle. Obstruction of blood to the heart muscle. Okay, so any of these vessels getting blocked can cause it. So let's look at some of these vessels here. So here's a model of the heart. This is the right side, so right atrium, right ventricle. Coming directly off the aorta here is this first branch, and this makes a lot of sense. It's shooting down the right side. Okay, so you can probably guess that this one is the what? That's the right coronary artery. It's right between the right atrium and the right ventricle on the right side of the heart. So that makes sense. Okay, so coming around the other way, we can see this little branch. And it looks like it's plugging into the pulmonary trunk, but it's not. Why would it be bad if this was plugged into the pulmonary trunk? What's different about that blood? Yeah, there's no oxygen in it. It's already deoxygenated. In fact, it's headed up here to go to the lungs to pick up that oxygen. So this is not plugged into there. It goes underneath the pulmonary trunk, and it's attached to the aorta underneath there. So it stops being the left coronary artery right here where my fingertip is. Everything above that is left coronary artery. Okay? Now, what happens then is it branches. It goes this direction, and it goes in between the let me drop that, the atria right there, and the ventricle, and here traveling down that way, this is called the circumflux artery. The other branch of it, and this is a trend that you'll notice as we study anatomy, that the names of these arteries and veins change when either they branch or they come together. So this was left coronary until it branched into circumflux, and then left anterior descending. And so as they either come together or they branch out, that's when their names change, which is handy for the next unit. Okay, so this right here, left anterior descending. So you can see that this vessel covers pretty much the entire left ventricle. That's why this one's really, really important, because it's what allows for blood to reach these muscle tissue, this muscle fiber here, so it's able to contract and push the blood up. Now, a distal obstruction is not nearly as deadly. So like if there was a part here where it was blocked off, it means just the local area around there would experience infarction and would die off. But a proximal obstruction up here would cause everything below that to be starved of blood. So that's why the positioning of where these things occur makes a big difference. So to find out like where, if people have these obstructions and stuff, they can do a test. The test is called an angiogram. Angiogram will tell you exactly what it is. An angio means vessel. Okay? Angioplasty is a procedure with vessels. In plants, angiosperms are plants that produce fruits. Angio means vessel. Sperm means seed. And so like anything that produces fruits like apple trees or pear trees or anything like that is called an angiosperm because the seeds are encased inside of a fruit, which is the vessel. Gram means record or picture, recording, anything. Basically, it's results. So angiogram is a test to view blood flow in vessels. Now, it can happen anywhere. They can do an angiogram to find out what's going on in your carotid arteries in your neck. Most of the time, angiograms deal with the heart because it just has a really, really important function. Because I mean, if it doesn't do its job, then nothing works. Rats. This is dead. So they can look on this angiogram to see what kind of blockages or how much blood flow is going through a vessel and stuff like that, and see if somebody needs something done about the blood flow in their heart. And there's a couple different procedures that can be done if there's not enough blood flow. Anybody know what they are? One of them is 5 letters and you had to spell it. Starts with an S. A stent. Yes. Okay. So a stent is one of those things they can use to open up that vessel. Let me see if I can find you an angiogram here first so you can see what that looks like. They'll inject, you can't just look at an x-ray and see somebody's blood vessels, but they'll, because blood vessels like muscle and skin and stuff like that really don't absorb x-rays, and so that would pass straight through. And I'm not even 100% sure that x-ray is what they use. So they have to inject the blood vessels with a dye so the blood flow would show up, so they could see that. Just a second here. Okay. A little music while we wait. Do 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 do. Can we see that? Wow, that's bright. Okay. Images. Yes.
What was the theme song?
I think it was, is it Bewitched, maybe?
Yeah, it was either...
I Dream of Jeannie or something. Is that what it was?
One of those two.
All right. See, like they can do an angio... Oh, it's a little too bright, so I can turn down the brightness here. So these are different angiograms. Here's one of the brain. Here's one of the heart. And they're looking for obstructions. They're looking for areas that are kind of narrowed. Yeah, like right through here. You should. This looks good right here. That is what the blood flow should be, nice and dark, like blood's flowing through there, no trouble. But here we have some sections that are not showing up as well. Let me see if I can find some others here. There we go. This is coronary artery disease. So like this is what the blood flow should look like. It's things moving through there. But you see how this almost looks like it's pinched right here? You see blood flowing through normally until it hits this spot, and then it's almost like there's no way through there. There's like a gap. That's because that is filled up with plaque, most likely, that is not allowing the blood to move through those coronary vessels. So like Ideally, here's a couple blood vessels here. Here's normal. Blood's just cruising through, having a good time, you know. But then you get you another blood vessel here, and over time, there's a couple things working against it. One of those is these plaques that build up on the inside of the vessel. And these plaques building up, and it's not the same plaque that's on your teeth. The plaque that's, not that you have any on your teeth right now, but like the plaque that builds up on your teeth overnight as you sleep is basically nothing but pure compacted bacteria that just piles up on your teeth. It would be really bad if you had that in here. This plaque right here is mostly LDL, not LOL, that's what it looked like. LOL, cholesterol, no. LDL and VLDL, LDL, cholesterol. LDL stands for low density lipoprotein. It builds up in our blood vessels and builds up on vessel walls. The tricky part about it is that our body does not like when our blood vessels aren't smooth flowing on the inside. So when this junk builds up and it's all rough looking, our bodies have a tendency to lay down a layer of tissue on top of that, or that'll build up in between these layers of tissue. So like, it's not that you can just scrape it out, it's like built up in there. So blood's trying to sneak through this little bitty gap here, which makes it tough. So when they talk about like 90% blockages or 99% blockages in certain coronary arteries, that's what they're talking about, is that passageway where the blood's trying to get through, can't get through. Any guesses what VLDL stands for? If LDL stands for low density lipoprotein, what do you think V stands for? Just guess. Very. Yeah, very low density lipoprotein. Seriously, yeah, that's what it's called. These are both the bad cholesterol because they build up in these vessel walls. But then there's also what's called a good cholesterol, which is, any guesses? If low is bad and very low is worse. Yeah, high density lipoprotein actually helps clear out cholesterol. So when they test your blood for cholesterol, they test how much LDL and VLDL you have, but they also test how much HDL. And if your HDL levels are a little higher, that's a good sign because that helps kind of clear that stuff out. But if your HDL is low and your LDL is high, that's not good. Okay. So treatments then. Corrective procedures. And they're not limited to just these two. These are just the two most common corrective procedures. First is what we just talked about, is the stent. Stent is a small spring that expands blood vessels. Okay. So basically what they're able to do then is take this little spring-loaded tube and then put it through a catheter in someone's leg or arm into a major blood vessel, and with a camera direct it all the way back up to their heart into that vessel, put it where it needs to go, and then it placed it in there and it springs open to open up or spread out that blood vessel. Because remember how stretchy in the lab we were messing with those blood vessels? They're really stretchy, okay? So it will spread that out so blood will flow through it. We had a teacher here that when he had retired from the university and then taught here for a little bit, And I asked, he came back to visit. I said, how are you doing? He said, I just had a stent put in. He said, it's amazing. Like, it was like instantly was feeling better. Like, he had a lot of blockage and slow flowing blood through his heart. He said, it was crazy. The moment they put it in, I felt better. He said, it was like euphoria. He said, did you guys like inject me with some kind of a drug? They said, no, we just put the stent in. He said, why do I feel so good? He said, well, that's how your heart should feel when you're getting all the oxygen that you need. So yeah, that had just become his new normal, was that blocked blood flow. So stent is one procedure. My grandpa had the same kind of thing. We thought he was pretty much at the end, you know, because he was starting to fade and he didn't have much life in him. And they put a stent in. He was a whole new dude. It was crazy. All right. Yeah, he went from what looked like death's door, and then like the next week he was trying to show me how to sharpen my chainsaw chain. He's like, you got to just put an edge on it. And he's like, I don't know why I'm telling you this, but he's like, Andrew, you don't sharpen a chainsaw chain, you keep it sharp. I'm like, okay, thanks, Grandpa. That's a good advice for chainsawing, you know. Bypass surgery. I'm not good at transitions. Oh, yeah. He also had that bypass surgery. This is where they take a vein from an arm or leg and bypass blocked vessels, blocked coronary vessels. And the one I saw, they stitched it directly into the aorta. So like, let's say there is a vessel that is pretty much completely clogged full of junk. It's filled up. So what they'll do, and usually they'll take either the great saphenous vein, which is in the inside of the thigh, or they'll take one from the inside of the arm there, and they'll loop it around this bypass, this area that's blocked, and they'll stitch it into the blood vessels surrounding there. So blood that wants to go that way, and it would hit that obstruction, would rather go through then this bypassed vessel and then head to its destination. Now, bypass, double bypass, triple bypass, quadruple bypass, just has to do with how many of these coronary arteries they're needing to go around, whether it's just one, it's just the circumflux, or if it's the, you know, a number of different other blood vessels that they have to bypass. It just depends on how many they're doing. Okay, just a couple minutes here. I'm going to briefly describe a few more conditions of the heart. Okay. This is not by any means a comprehensive list. There could be hundreds of conditions of the heart, but these are just kind of categories. Other heart conditions. First is heart failure. Sometimes called congestive heart failure. This doesn't mean that it stopped. All that means is the heart is not working efficiently. Okay? That means that it can't clear all the blood in one squeeze. my grandpa's cardiologist told him, he said, Gordon, what you got is a case of big old floppy heart. That's what he told him to describe heart failure. It's like it wouldn't clear the blood in the way that it was supposed to. It couldn't push it all the way out, and it continuously filled, and it was trying to work harder and harder. The symptoms of this are low energy. Okay. You're going to have fluid buildup in tissues. It's called edema, fluid buildup. And then low oxygen, low blood O2. Okay. You can actually live for decades with heart failure. My mom's mom and my dad's dad lived more than 10 years with what was considered heart failure. So it's kind of a weird way to put it because it sounds like it's quit. It just means that it's not doing what it's supposed to. Next would be septal defects. A lot of times these are congenital. You have these before you're born. Some people have them. You might have one right now and not know it, and you might live your whole life and be fine and not know it. But the septum, you guys remember what the septum is? Interventricular septum? What's it do? It separates, right? The right and left side. So these are holes in the septum. We naturally have one before we're born. We have a hole between the right and left atrium. So blood can flow between those two because that whole trip to the lungs thing, yeah, it's a wasted trip when you're in the uterus because your lungs aren't really doing anything except for developing. Okay, so there's a hole that seals up called the foramen ovale that's there normally. Some people have what's called a patent foramen ovale, which it never actually seals after that. And some people live their whole lives and don't even know that they had that, and it doesn't affect them. But if you have a number of holes in the septum causing mixing of oxygenated and deoxygenated blood, causing mixing of oxygenated and deoxygenated blood. Two more. And like I said, this is not a comprehensive list. A heart murmur is an abnormal heart sound. And that is anything other than lubbed up. If it doesn't just sound like lubbed up, something's wrong. Okay, so many of them are benign, like there's nothing that's actually wrong or worry about. They don't call it benign though. It's a weird word they use. They call it an innocent heart murmur. Innocent, yeah. But some of them are signs of greater problem. Some of them correct themselves on their own and go away, and some go away and then come back again. And it has to do with what's actually causing them, which could be a number of different things. One of those, and that'll be the last thing, would be this: valve failure. Those valves are really important. It looks like valve failure. One or more valves don't open or close correctly. More common of the ones that fail, it again, form follows function. Mitral valve prolapse is a really common one. Or causes blood to regurgitate back into, that's a gross word for that, but it's the actual word. Blood goes back into the left atrium. It's flowing backwards. They can fix this with either an artificial valve or sometimes a pig heart valve to replace that when that goes out.